Hello, everyone. Welcome to week 9 of our anatomy and physiology class. This week, we shall review the reproductive and endocrine systems. So let us start with Ma'am Susan Valderrama for questions. Ma'am Susan, what is the prime? Good afternoon, Ma'am Susan.
To produce adenylates such as testosterone to maintain any reproduction function and to promote spermatogenesis and transport into the female reproduction system for fertilization.
Ay, kompleto. Okay. Yung pinaka-importante niyang function, okay, it's about male reproductive tayo ha. Okay. To produce, maintain, and transport sperm and semen. Number 2, Ma'am Susan, what is the primary function naman of the female reproductive system?
This organ is responsible for producing its terminal eggs or ova, regulating sex hormones and maintaining fertility. They develop into mature fetus ready for delivery.
Okay.
Ay,
So
kaya ko, maingay kasi nasa kalsada ako.
Ay, ingat po kayo.
Okay lang po, okay lang po.
Okay. The primary function is to produce the female egg cells called the ova, or another term will be oocytes. Number 3, Ma'am Susan, in addition to sperm production, what hormone do the testes secrete? So
The testes synthesize two essential products, testosterone needed for the development and maintenance of many physiological functions, including normal testes function and sperm needed for the male fertility.
Wow, completo. Good. Number 4, what is the name of the pouch of skin and connective tissue that contains the testes?
The testicles are located underneath or penis. They're closed in a pouch of skin called the scrotum.
Okay. Scrotum, very good. Number 5, which two muscles help regulate the temperature of the testes? So, di ba pag, okay, mga nakaka-relate dyan. Ay, walang
Remaster
ganun.
muscle.
Okay, and there are 2 po.
And, wait. Teka, meron ako na.
Okay.
Remaster muscle. Spermatus cord pa yun, no? Tama ba ako?
Hindi po muscle po, muscle. It's also a muscle. So pag malamig, umaakyat papunta sa katawan kasi mainit ang katawan. Pag mainit, bumababa. So ito yung 2 muscles.
Remaster muscle lang to yung na ano ko eh. And it's
Okay.
spermatic cord.
There are actually 2, the cremaster muscle and the dartos muscle. Don't forget that.
Yun ang wala ko.
Okay, where are the sperm produced? Saan po napoproduce ang sperm?
They stays inside the semiparous tubules, which is a covulated cluster located inside the testes.
Okay, so nasa
Testosterone production.
Okay.
Certain cells the sperm's tubular called Leydig cells.
Okay, napaka-kompleto. Okay, yung seminiferous, yun, nandoon po sa testes. Okay, what do you call the cells that secrete testosterone?
Leydig cells.
Or the interstitial cells, yeah. Yan, so that's the old name for the Leydig cell. Okay, they make the testosterone, the interstitial, in between cells, no? What is another name for the ductus deferens?
The vas deferens, singular. It's also called a ductus deferens or sperm duct.
Okay. Which structure is ligated during a vasectomy?
Both types of vasectomy is divide and close off the end of the vas difference.
So anong tawag po? Kaya tinawag na vasectomy.
Wait lang daw.
Napaka-obvious nito.
Ako nga, nakakaano eh.
This is what happens when you do vasectomy, no?
There's a vast difference, Doc.
A vas
Di ba yun?
difference. Yes.
Okay.
What carries structures, the blood vessels and nerves to and from the testis? So ibig sabihin, ang laman nito are blood vessels and nerves that go to and from the testis. Ano pong tawag sa structure? Ano po tawag dito?
Spermatic cord, Doc.
Very good. Spermatic cord. What are the three structures found in the spermatic cord?
Different duct, piniform plexus, and cremaster muscle.
Okay,
Tama po.
detailed tong sagot nyo. Okay. We have the external spermatic fascia. Andun na po yung plexus na sinasabi nyo. Then cremaster muscle and fascia. And the internal spermatic fascia. Okay? Number 12. Anong tawag sa accessory gland located behind the urinary bladder?
Seminal vesicle, Doc.
No.
Tama po.
Ano ba yung vesicle?
Yung
Accessory gland located behind the bladder. Ang counterpart nito sa babae is uterus.
hindi ano to?
Hindi po.
Saccular glands posterior of the urinary bladder. Tama
The
po ba?
prostate gland.
Okay.
Nasa likod po siya ng bladder. Actually, sa Chinese, if you treat the prostate, you always consider the bladder. Number 13. Which gland forms a ring around the urethra?
The prostate gland.
Very good. Tingnan niyo po, andito. So, napaka-importante ng prostate. Next, which glands are located beneath the prostate, sa ilalim ng prostate, within the urogenital diaphragm? Ma'am Susan. Nawala si Ma'am Susan. Ma'am Susan? Nawala bigla. Naku, nawala yung... Uy, nawala siya talaga. Wait lang. Who would like to answer this? What glands are located beneath the prostate within the urogenital diaphragm?
Bulbourethral gland, sir.
Very good. Bulbourethral.
Okay, sorry Doc, nawala. Nawala po.
Okay lang. So, nandito yung prostate. Kung nakikita nyo, naka-form siya nakasurround siya sa urethra. Kaya pag lumaki yung prostate, mahirapan umihi. No? So, we have to make sure na hindi lumalaki, nag-enlarge yung prostate. And then beneath that would be your bulbourethral glands. Okay, Ma'am Susan, in the penis, which structure surrounds the urethra? Ma'am Susan?
Last po. Number 15 na, Doc.
Opo.
Tama ba? The corpus spongiosum.
Yes. Corpus spongiosum. Andiyan po. No?
Para siyang sponge.
Yes. So, ito. Next, which fold of skin surrounds the gland's penis? Yung tinatanggal pag nagpapatuli. Okay. Anong tawag po doon?
Doko sagot ko doon, pineal, refuse, or
Refuse
foreskin.
or skin. Very good. Which
Okay.
structures, katabi po ito ng corpus spongiosum, which structures are paired dorsal erectile tissues? Ito yung pag napuno, tumitigas. Kaya pag may problema tayo sa circulation, hindi siya titigas. Ano po tawag doon? Since there are two, you don't say corpus, so corpora. But the question is, ano ang name dito po?
Tis cavernosa, Doc? Tama po
Yeah,
ba?
corpora cavernosa.
Okay.
So, singular is cavernosum. Andito si corpus
Caverno.
callosum. So, ito yung nagpapa-erect. Number 18. Why is the female's reproductive system more complex than the male's?
The female reproductive system is more complex than the male system. But it's growth multiple structure, cabbage uterus, and the cyclic effect upon it by the menstrual cycle, the ovaries, and the major produce of hormones and gametes.
Okay, because they produce gametes and they also
Gametes.
protect and give nutrients sa developing embryo. So, ibig sabihin, napakalaki ng role ng female reproductive system. Number 19, which organs will produce the ova, estrogen, and progesterone?
Ovaries,
Of course, you should know that. Okay. Ovaries. Andito po yung ovaries. Okay? Kaya hindi ka mangingitlog pag malamig. Pag nakaupo ka sa, pag nakababad ka parati sa malamig na tubig. Yung iba nakaupo sa semento, no? Mhm. Yung iba naman,
ganun yun.
ang
Pag
ginagamit
malamig.
na malamig na tubig. Kaya, tapos mayroon ka, yeah. Number 20, where are the ovaries located?
Organ in the pelvis, the inner
Yes.
arc between the hips.
Pelvic cavity. Very good. Thank you very much, Ma'am Susan. We will call you again later.
Sige po.
Thank you so much.
Thank you, thank you.
Okay, let's say welcome naman kay, congratulations po, Ma'am Susan. You practically answered all the questions. Let's go to Sir
Thank you.
Froilan. Good afternoon, 21 to 40.
Good afternoon, Doc.
Good afternoon. Ito naman na maka-obvious. Which ligament attaches the ovary to the uterus?
Ovarian ligament.
Okay, very simple. Okay, for those who still do not know, ito po yung ovary, andito po yung ligament. So yan ang nag-a-attach ng ovary sa uterus. 22. Which portion of the ovary does oogenesis, ibig sabihin nagpo-form ka ng egg, no? Occur in the cortex or the medulla?
Cortex.
Very good. So andito po yung cortex natin. Di ba meron din tayong adrenal cortex? Meron. Okay. Number 23. When does oogenesis begin in the female? I'm sure you know what is oogenesis, no? Kailan siya nag-uumpisang mangitlog? Okay.
Before birth.
Before birth. Wow, ang galing. Number 24. What structure, which is formerly called the corpus hemorrhagicum, produces progesterone and estrogen?
Corpus luteum.
Wow. Ang galing. So, andito po yung corpus luteum. Next, what structure carries the ovulated oocyte? So, ibig sabihin ng itlog na from the ovary to the uterus. Marami po siyang pangalan.
Fallopian tube or uterine tube or oviduct.
Wow, kumpletong-kumpleto. Mag-gynecology kaya. Where does fertilization usually occur? Nako, this is very basic, ha?
Fallopian tube.
Yes. Fallopian tube. Kaya meron tayong tinatawag na ectopic pregnancy. So, kailangan swak na swak niya. So, pag nagka-ectopic pregnancy, malaking problema. Is there any direct contact between the infundibulum and the ovary?
No.
Wow. Ito po yung infundibulum. Wala po siyang direct contact. Nakikita niyo. So, ibig sabihin, pumapa. Okay. Wala. Number 28. Name the rounded region of the uterus above the opening to the uterine tubes.
Fundus.
Yes, fundus. Ito po yung fundus of the uterus. Next, what is the largest portion of the uterus?
Body, also known as the corpus.
Okay. Parang mali yata itong dito. Yeah, the body. Some are saying also which contains the cervix. So I think the answer should be body. Which narrowed uterine structure projects into the vagina?
Cervix.
Narrowed. Structure sa uterus na nagpo-project into the vagina. Yeah, the cervix. What part of the cervix? It's called the isthmus of the cervix. Okay?
Oh.
Isthmus. Very specific lang po ito. No? So, ito yung nagpo-project sa vagina. Next. What is the thick layer of smooth muscle that is important during childbirth?
Myometrium.
Myometrium, yes. And that is the reason why we don't do LI4 and spleen 6 on pregnant women pag hindi pa term. Kasi baka lumabas yung bata. No? Ganun po
I like for it.
So, but kung para hindi mahirapan yung label, lalo na pag primary, no? Primary grav, yung bago lang na, yung una-una pa lang, kailangan na pwede mo nang i-momoksa mo na siya habang nagle-labor para mapabilis. Okay? So, we are really looking for that time na importante na po tayo sa OB. Okay. What is the innermost layer lining the uterine cavity?
Endometrium.
Yes, very good. Name the 10 cm muscular tube that extends from the uterus.
Fallopian tube.
No. Nag-extend from the uterus. 10 centimeters lang. So stretchable siya. Kaya minsan yung pag medyo mahaba o malaki. So, anong tawag? Give it another try. Galing sa uterus nag-extend. So it's a muscular tube. Okay, vagina.
Oh. Vagina.
So yung iba
10
dyan,
centimeter din kasi sa fallopian, 10 centimeter din sa vagina, kaya confusing.
yes. What are the recessed areas around the cervix called?
Fornix.
Yeah, the fornix or the vaginal fornix. Dito, recessed area. So that's the vagina. So can you imagine? So 10 cm lang talaga. Okay, what general term describes the female's external genitalia?
Vulva.
Yes, or pudendum.
Pwede pa.
Gusto ko sabihin yung Filipino term pa, pero parang ang bastos na pag sinabi mo.
Dok, kaya pala puday.
puday.
Baka maban tayo, di ba? Pero ay, biglang natauhan si Sir Mart. Akala ko ba busy?
Kaya pala, it
Pag
makes
mo
sense yung
dito
puday.
Sir Mark, mahilig ka ba sa puday?
Sabi mo na lang,
Ganyan,
pentendum na lang.
Pudendum.
Kasi medyo
Pentendum.
ng konti. Okay, what structures Okay, ito yung counterpart ng male scrotum. So, sabi nila yung mga ano, kinukwento kasi sa akin nung, okay, nagagamit, yung mga sexual reassignment. So, naiiwan yung scrotum nila. So, parang ito yung ginagamit, no? Pag naging babae na. Okay, anong tawag dito po? What structures are paired adipose-containing folds and are the homologues of the male scrotum?
Labia majora.
Yeah, so we cannot show that here. Baka maban tayo sa YouTube. Which area is enclosed by the labia minora? So kung may majora, merong minora. So anong area ang ini-enclose ng labia minora?
Vestibule.
Vestibule. Very good. So kung ito yung labia majora, okay, so yung labia minora nandito. So ini-enclose niya po yung tinatawag na vestibule. Number 38. What two orifices are contained in the vestibule? So pag nag-i-intern kayo, kung sakaling magme-medicine kayo, kailangan alam mo talaga kasi may dalawang openings. Lalo na pag ano ka, ka-catheter, no? Oo. Huwag mo ilagay sa so, so okay. Kasi dalawa yung butas.
Urethral opening.
Anong tawag dito sa dalawang butas?
Urethral opening and vaginal opening.
Okay, very good. So yung nasa taas, urethral opening, kung sakaling darating yung time na
Vaginal.
mag-i-insert kayo ng catheter, okay, dito nyo po ilalagay, no? Mas maliit, mas makitid. Number 39. Name the circular pigmented area that surrounds the nipple.
Areola.
Areola. So, kung meron kang yung iba, yung pag nagka-cancer, yung areola pumapasok, nag-i-invert yung nipple, no? At ano niya parang pongkan yung itsura ng breast. So, pag ganun na, kailangan ka na magpatingin talaga. Huwag mo nang antayin. Okay? Number 40, which structure produces milk in lactating females?
Mammary gland.
Okay, very easy. Congratulations po, Sir Froilan. Maraming
Thank you,
salamat.
Doc.
We'll call you again later kung may time pa. Number 41.
Thank you.
Punta na tayo kay Sir Tyrone na napaka-ready kanina pa. Okay, number 61 to 80. I would like Ma'am Mercedita to take care, 61 to 80. Tapos 81 to 100 si Sir Walter. No? Okay lang. Okay.
Okay po.
I'll prepare. Okay. What do the lactiferous ducts expand? Okay. To form what?
The lactiferous sinuses
Or the nipple. Okay?
or the nipple.
Expand siya para maging nipple. What does endocrine or endocrine mean?
Endocrine refers to a tissue that makes and release hormones that travel in the bloodstream and control the actions of other cells or organs.
Okay, tinatawag siyang yeah, correct. Endocrine to secrete within.
Within,
Yeah, ganun din yung meaning. Pinaisip ko lang. Number 43. What does the endocrine system influence?
the endocrine system influences the metabolism, the growth and development, the mood and emotions, the reproduction, the sleep-wake cycle, the blood pressure, and the homeostasis.
Okay. Dito nyo makikita na napaka-importante ng endocrine system because they influence the metabolic activities of cells by means of chemical messengers called hormones. No? So meron silang mensahero. Ang tawag dyan, hormones. Okay, Sir Tyrone, what is the function of the endocrine system?
The main function of the endocrine system is to release hormones into the blood while continuously monitoring the levels.
O, diba? High-tech sila. Parang, messaging, no? Ini-integrate niya yung body system. because as much as possible, we have to maintain the yin and yang balance or homeostasis by using hormones, which are called chemical messengers. So dapat may good communication. Diyan papasok ngayon yung importance ng nervous system, ng ating circulatory system. What are the effectors of the endocrine system o yung mga nagpapatupad ng kanilang message?
The effectors of the endocrine systems are the hormones, the target cells or organs, and the receptors.
Okay, so basically, the responsive body parts and the autonomic via the autonomic nervous system. Remember, ang nerve impulse ang ano nito yung chemical messenger. So ang nag-epekto niyan would be the body parts in response to the autonomic nervous system. Kaya kung masyado kang stressed, mas lalo mong pinapagana yung sympathetic, magkakaproblema talaga, no? What are the major endocrine glands? So this one we have to know.
Okay.
And
The
you-
major
and
endocrines are the hypothalamus, the pituitary gland, the thyroid gland, the parathyroid gland, the adrenal glands, the pineal gland, the pancreas, the testes, and the ovaries.
Meron ka pa nakalimutang isa, thymus.
Thymus.
Okay. We will all take this up one by one later. Okay, true or false? One cell is capable of more than one activity.
True.
Very good. How does a hormone find its target tissue? So remember, a hormone is a chemical messenger na pinapadala ng hypothalamus, no? Okay, so paano niya hinahanap yung target tissue? Ano yung kailangan meron ka talagang ano ba to? Kailangan alam niya kung kanino ipapadala yung message. Meron siyang so paano niya malalaman ngayon yung recipient?
Through the receptor proteins.
Yes, very good. The cell must have a protein identifier and receptor. Kaya kung kulang ka sa protein, baka mamaya hindi dumating yung message. Now you see it, no? Kailangan importante po talaga na da-digest natin yung ating kinakain, no? May nakukuha tayong ano. By the way, I have a question. This is just a review, no? Ano po yung building blocks of protein?
Amino acids.
Very good.
Amino acid.
Yeah. Okay, unahan.
Thank
Okay.
you, thank you.
Sir Tyrone, what are the two types? Parang mali yung question, no? What are the two types of glandular functions? Or ano yung functions ng gland? Two general functions ng gland.
The two types.
Oo, we just mentioned endocrine. So the other type is,
Sandali.
anong opposite ng endocrine?
Exocrine.
Exocrine. Very good. So ano kaya yung exocrine na yan? No? Mamaya malalaman natin. Let's start with endocrine glands. Sir Tyrone, pag pinagtanong sa iyo na pasyente, how are you going to explain in a very simple way? Bakit sa
Nagsisecrete ng hormones. Nagsisecrete ng hormones directly into the bloodstream.
Okay, meron ba silang tube? Meron ba silang duct?
Meron.
Wala.
Wala. Wala. Mag-aral ka. Okay, these are ductless glands. Kaya, di ba, within sa loob, no? Okay. So, they release hormones, and the hormones will control the metabolism, the metabolic processes. Okay? So, pag endocrine, walang ducts. Diretso yan sa bloodstream. Okay? Next, ano naman ang exocrine glands or exocrine glands?
It's a gland that makes substances such as sweat, tears, saliva, milk, and digestive juices, and release them through the duct or opening to a body surface.
Okay. They release to the outside of the
Release.
body. Katulad ng, what are examples of exocrine? Yung pawis natin, no? Yung
Sweat, laway.
sweat glands, sebaceous glands, salivary. Okay. What is a hormone, Sir Tyrone?
A hormone is a chemical messenger produced by endocrine glands that is released into the bloodstream to regulate various physiological processes and maintain homeostasis in the body.
So, ibig sabihin, ito yung code. Ito yung sinisikret ng endocrine gland, diretso sa bloodstream, kasing endocrine glands wala pong duct, no? Diretso sa
Walang-
bloodstream, and then it will act on a specific target tissue para magkaroon ng response. Ano po yung function ng hormones?
Regulation of metabolism, growth and development, reproductive functions, stress response, maintenance of homeostasis.
Okay, very good. To alter metabolic activity. They know
Yes.
what they want. Ang magre-respond lang dyan, yung hawak yung, ano nga tawag doon yung, pag mayroon kang code, kung mayroon kang, kung na-scan mo yung, ano tawag nga doon? Di ba, sir?
QR code.
Oo,
Scanner.
yeah, QR code. Kung wala ka,
Mm.
no, walang effect, no? Okay, what can influence hormone levels? Or anong makaka-apekto po sa hormone levels? Kaya nauso ngayon yung hormonal imbalance. And I tell you, most of the patients that will come to you, since naniniwala tayo na karamihan, yun ang problema ng sakit, so magkakaroon ng hormonal imbalance. So Sir Tyro, what can influence hormone levels?
Hormone levels can be influenced by age,
Mhm.
stress, diet and nutrition, physical activity, sleep, changes in balance of fluid and minerals in blood.
Okay, very good. Number one, ang stress.
Stress.
Saka infection. Magkaka-infection ka lang naman kung meron kang predisposition, di ba? So as much as possible, dapat malakas yung immune system natin. And kung meron man tayong mga deficiencies, we need to correct it or tonify our ano. So ganun lang po. Kaya yung iba madaling dapuan ng sakit dahil may deficiency na meron na po silang comorbidity. And also when you have changes in the balance of fluid and minerals in the blood. So ito na po yung tinatawag nating mga yin, yung nutrition, no? Yeah, you were correct. Fluid and so pag nagkulang ka na sa yin, yun. Kaya dapat yung mga kinakain natin may sustansya or natutunaw yung kinakain natin. So pag mababa yung calcium mo, affected din talaga yung hormone levels mo. Okay, Sir Tyrone? Okay, ano ang tamang sagot? Do you need a large amount or small amount of hormones to get desired response? Kailangan bang marami or kokonti lang?
Konti lang, no?
Very good. Ang galing. Because very potent po ang hormones. And then, ang effect niya long-lasting. So, ibig sabihin, ganun din yan, no? Di ba? Pag nagpa-practice tayo, wag masyadong damihan yung points. Yung iba kasi tinutusok lahat eh. Ang importante quality. Saka matindi yung effect, no? Hindi po ito paramihan. Lalo na pag naninidol ka sa tenga, no? Lahat na yata ng inano mo na. Kasi if you use too many points, chances are you will not get the desired result, the opposite result. There's always the
Yes.
possibility of overstimulation. Kaya less is more. Okay?
Yes.
Okay, Sir Tyrone, are hormones regulated by positive feedback or negative feedback?
Negative.
Very good. What are tropic hormones?
Tropic hormones are type of hormone that stimulate other endocrine glands to produce and release their hormones.
Okay. So ito yung parang nangangapit ba?
Hormones that target other
Kaya
endocrine.
yeah. So they target other endocrine glands to stimulate their growth or secretion. So meron siyang domino effect, no? Ultimate goal is domino effect. Yun din ang gusto natin mangyari. The reason why we add points to our treatment is, so now you can see how exciting the art of acupuncture is.
Yes.
You need to always make sure na yung tinutusok mo, kailangan talagang tusukin. Kaya wag niyong iwala yung inyong mga probe, especially when
Yes.
you do it on the ear, no?
Yes, yes.
Which hormones target reproductive tissues or glands?
The gonadotropins and the sex hormones.
O, diba? Sex hormones. Okay. What do anabolic hormones stimulate? So, can you tell us ano po yung anabolic?
Anabolic hormones, it's the process of building up complex molecules from
Very-
simpler ones within cells.
Okay, very good. Excellent. And number 60, ano naman tawag? What are local hormones?
Local hormones, also known as autocoids, are signaling molecules that act within a restricted area.
So they are not transported through the bloodstream. Local nga eh. Katulad din ng local points sa acupuncture. Okay, those are local hormones. Thank you so much, Sir Tyrone. Congratulations. You practically
Thank you,
answered
Rob.
all the questions. And good job. Talagang excited na yata kayo matapos tayo next week. Thank you so much.
Thank you so much, Rob.
Now let's call on Miss France.
Ito number po.
Response.
Merci beaucoup.
Mercy. Mercy beaucoup. Darian, doctor.
Yeah, ay, whatever. Okay, Ma'am Mercy, what do paracrine secretions do?
They act on neighboring cells.
Wow. Ano ba tawag dito? Paano nangangampan?
Marites.
Ano naman ang tawag? I think si Sir Tyrone mentioned this earlier, no? Talagang kinumpleto niya. Ano naman ang ginagawa ng autocrine or autocrine secretions?
Yung it act on the source, its source, a cell itself.
Very good. What are prostaglandins?
Yun. Prostaglandins are a group of lipid compounds,
Mhm.
paracrine substances that mimic hormones produced by tissues or particular organ, regulate cellular response of to hormones, wide variety of functions, act locally.
So they are practically lipid, no? Na
Lipids. Opo.
okay, so prostaglandin. Na pareho ang effect sa ginagaya ang hormones. So pinoproduce ito ng tissues specific sa organ. Okay.
Mhm.
What are two classifications of hormones?
Steroids and non-steroids.
Okay, very good. Saan galing po ang steroids?
Sa cholesterol po.
Cholesterol. So pag mataas yung cholesterol, okay, nagkakaroon tayo ng, okay, what is a steroid made of?
Structural lipids.
Okay. How does a steroid enter a cell?
They enter the cell by passive diffusion because both of the hormones and the cell wall are fats or lipids.
Yeah. So, kaya madali siya makapasok sa cell. Next, where is the receptor for a steroid located?
In the nucleus of the target cells.
Very good. Steroid hormones are insoluble in what?
Water.
Okay, they never mix. What does the hormone do to the cell?
Alters the chemical process of the cell, act as signaling molecules that coordinate a wide range of physiological process in the body.
So binabago niya talaga, no? Wait lang po. Okay. Where are non-steroids produced from?
From amino acids, protein-based.
Okay. So anong gusto natin? Yung non-steroids? So doon tayo sa protein.
Yun na lang, non-steroids na lang.
Kasi alam nyo, ganito lang yan eh. So kung yung ating lifestyle, mas nag-accumulate ng cholesterol, so ma-activate mo talaga yung mga steroid hormones. No? How does a non-steroid enter a cell? Yung kanina, yeah, you talked about steroid hormone entering a cell. You said it's passive diffusion. What about a non-steroid?
Non-steroid is facilitated diffusion, requires a receptor on a target cell membrane.
Very good.
Kasi yung pong kanina, yung diffusion, basta may taba lang, matunaw na siya, doon na siya.
So ibig sabihin, pag mas marami kang taba, mas madali.
Mas, kaya hyper minsan yung mga matataba din eh. Bilis nila pagpawisan.
Oo, tapos umiitim dito. No?
Mm.
Next. Yan po ang facilitated diffusion. No? Kailangan po ng receptor. So medyo mahirap. So kung patay na yung wala kang mga receptor dyan, nakatabon, so wala ring mangyayari. Next. What is the process by which a non-steroid enter a cell?
Hormone binds to the receptor on a cell membrane. Hormone passes messages on the second receptor inside the cell, which carries out the cellular changes.
Okay. Very good. Receptor pa rin, which we illustrated earlier. And then medyo naging complicated kasi kailangan pinapasa-pasa, no? Sa another receptor. A little bit complicated.
Opo.
Yes. Can you
Katulad po nung yung sa small intestine, yung sa hunger, halimbawa pagka naramdaman na merong food, magre-release na siya ng so the hormones, mag-release ng hormones yung small intestine. Una, may tatanggapin na siyang may natatanggapin na siyang pagkain to digest. Ganun.
Yes. Yeah, brilliant. Okay, what changes take place in the cell? Okay, alam naman natin meron tayong opening and closing of the ion channels, no? So, when it affects the ion channels, what changes take place in the cell?
Alters plasma membrane permeability and or changes into the membrane potential.
Ibig sabihin, nagkakaroon na siya ng charge, no? Nagde-depolarize na siya, hindi na siya resting. So, saka nagiging permeable na siya. Kaya napaka-importante kumain tayo ng maraming may protein instead of di ba? Okay. Hormone action can stimulate what kind of synthesis inside the cell?
Protein synthesis.
Okay. It speeds up. So, pinapabilis niya yung synthesis of protein. Alam naman natin pag this is the reason why some people do not have a strong immune system kasi kulang sa protein, no? What are some cell changes that take place as a result of hormone action?
Deactivate enzyme system. Includes secretory activity, stimulate mitosis.
Okay. So this is basically anabolic yung action, parang pinapadami, no? What are enzymes?
Enzymes are those which metabolize or synthesizes.
Okay.
Synthesizes.
They're actually called catalysts, no? They may be good, they may not be good, no? So meron tayong kanya-kanyang ano, kung gusto mong kukontrahin yung effect ng enzyme, you have to deactivate it. Okay?
Oo pala, parang catabolic nga pala
At
siya.
para siya yung reinforce. Yes.
Reinforce.
Okay, hormones activate which cells?
Target cells, which are identified by specific receptors for the hormones to bind to.
Okay, kung wala kang receptor, wala ring effect. And so this is the reason why we need to have a lot of protein kasi dito tayo nagpo-form ng identity natin. So baka hindi So I think from here you can already see how the endocrine system works, no? What are the 3 factors that target cell activation depends on?
Depends on blood levels of the hormones, number of receptors in the target cell, more receptors, meaning greater response, and the affinity of those receptors for the hormone, numbers of receptors on the target cell may change.
Okay, so this is the reason why we need to know the blood level. So kung sabi nga ni Sir Tyrone kanina, pag may negative feedback, syempre pag kulang, this will have a stimulatory effect on we call it the hypothalamic pituitary axis, no? So mamaya, especially when we talk about the thyroid hormones, okay? So depende din po ito sa number of receptors sa target cells. So pag wala kang receptors, walang response. And the affinity of the receptors for the hormone. Okay, anong ibig sabihin po ng upregulation?
Upregulation is the increase in number of receptors on target cell due to prolonged decrease in the level of hormones.
So automatic po yan, ha? Automatic siya. So tumataas. Siyempre pag pag andun yung need, a want, no? Kailangan tumataas yung number of receptors. Kasi nga matagal nang wala yung hormone. Para bang tig-gutom, no? Tag-gutom. Ano naman yung down regulation?
Yung kabaliktaran, decrease in number of receptors on the target cell due to prolonged increase in the hormone levels.
Okay, very good. So if masagana, so hindi kailangan, di ba? So konti din yung receptor. So basically, you have understood how the endocrine system works. Thank you so much, Ma'am Mercedita.
Thank you rin po.
Congratulations.
Thank you po.
Thank you po. Now let's call on Sir Walter.
Yes, good evening po.
Good evening. Okay. Ready si Sir Walter. 81 to 100. Okay, what is the hypothalamus?
Hypothalamus is a part of the brain that is part of endocrine system, which produce and can regulate the body temperature, heart rate, mood, hunger, and sex drive.
Is it a gland?
Yes, it's an endocrine gland.
Parang hindi.
Hindi po ba?
Minention ba?
Hindi po.
But it is
Thymus yun,
actually
hypothalamus.
siya yung parang siya yung parang CEO, no? Ano ba tawag dito? Yeah, basta CEO. Nasa lower central part of the brain. Okay, anong kinoconnect po ni hypothalamus?
So
What two system?
it connects to the brainstem. It connects to the brainstem via the dorsal longitudinal fasciculus, cerebral via medial forebrain bundle, hippocampus via the fornix, and pituitary via median eminence po. Tama po ba?
Yeah. Oo, mahaba lang ng konti pero okay lang. Okay, since part ng brain ang hypothalamus, so it's a nervous system. And then kinoconnect niya yung nervous system pati yung topic natin today, yung endocrine. So yun lang ang ginagawa ni hypothalamus. So the king of the endocrine, parang siya may kinalaman. No? So it's actually a tie-up between the nervous system, which is represented by the hypothalamus, and then the endocrine. Okay, anong kinokontrol ng hypothalamus? Anong gland?
Yes, hypothalamus can control pineal gland, pituitary gland,
Particularly the pituitary gland, no? Kaya ganito po yan, hierarchy yan, hypothalamus, then kakalabitin niya si pituitary. Okay? Tapos, sasabihan niya si pituitary to produce chemicals. No? Oo. So, depende. Pero depende sa, okay, kung ano yung nag-i-influence kay hypothalamus. So, palakasan yan. Kung may demand, so kailangan, like hihingi ng budget, kailangan na mas maraming ipoproduce na chemical si pituitary. So, hierarchy, hypothalamus. So, the pituitary gland is controlled by the hypothalamus. Sasabihan niya yung pituitary to produce chemicals. And these chemicals can either stimulate or suppress hormone secretions from the pituitary. Okay? So, kung titingnan nyo, magkalapit lang po talaga. So we're talking about the pituitary. So when you talk about the pituitary, we have the anterior lobe and the posterior lobe. Later, we're going to differentiate ano yung secretions ng dalawa. How does the hypothalamus control the pituitary gland?
by secreting releasing hormone such as somatostatin and dopamine.
Okay, so the hypothalamus, meron tayong tinatawag na releasing hormone. Okay? Tapos, i-stimulate niya si anterior pituitary para mag-release ng hormones. Okay? Now, si posterior pituitary, hindi siya nagre-release ng ano ba tawag dito? Yung nerve impulses galing sa hypothalamus will stimulate the nerve ending sa posterior. So, para mag-release ng hormone. So, ito pa rin yung kanyang role, nervous pa rin. So, pero may kinalaman yon sa pag-release ng hormones. So, ibig sabihin, the anterior pituitary will release hormones while nervous system yung nagko-control ngayon sa posterior. Can you get it? So,
Yes.
the hypothalamus, meron siyang tinatawag na releasing hormones, pero yung nerve impulses from the hypothalamus, ito yung mag-stimulate sa posterior pituitary gland para to release hormones. So, hindi siya releasing. So, yung releasing doon sa anterior pituitary. What is another name for the pituitary gland?
Hypophysis po.
Okay, very good. Okay, please describe the pituitary gland.
So pituitary gland is a major endocrine gland that has a pea size attached to the base of the brains. It controls growth and development and can control endocrine system like metabolism and can store and release hormones.
Okay, so nagsisecrete siya ng major hormones, major na major. Saan po ang pituitary gland located?
It is located at the base of the brain below the hypothalamus.
Okay, actually nandoon siya sa sella turcica, no? Sa base ng brain. Ito'y po yung sella turcica. Saddle siya. Sphenoid bone yan, no? Okay. Naka-attach siya sa hypothalamus via the infundibulum. Next. The pituitary is divided into how many sections or how many lobes?
2 lobes, anterior pituitary, the frontal lobe. The next one is posterior pituitary, is the posterior lobe.
Okay. Ano po yung anterior pituitary? Can you give us the old name of the anterior pituitary?
Wala po akong sagot, sir.
Okay,
Hindi
di
ko
ba
na ano.
mo kanina hypothesis kay kanino yun?
Okay, yes.
Kay pituitary. May name
Mm.
din si anterior pituitary. So dapat may apelyido siya, physis din.
Mm.
Ano kaya?
Adeno hypothesis.
Yes, adeno hypothesis. Kasi interesting ba? Actually, napaka ano nito ha. Um, so yung ano natin ngayon, focus is endocrine, no? So makikita nyo kung gaano ka importante yung endocrinologist, no? So yung adeno hypophysis is made of glandular tissue. Nagpo-produce po siya and nagre-release ng hormones. Ito po yung nire-release niya na hormones which we shall take up later. Now in terms of, alam nyo ba, if you know how to do it well, you know what are endorphins? Endorphins are actually feel-good hormones. They're actually pain receptors in the brain. Kaya kung magaling ka mag-needle, maganda yung ano mo dito. Like, it makes you feel good. Kaya, yun, kailangan marunong ka mag-acu. Di ba? Ang dami nating napapasaya. Ay, hindi lang yun. So, aside from endorphins, they also, make sure na maganda po ang release nitong mga hormones. Nakita nyo? Grabe yung impact, no? Kaya, lalo na pag nag-ear ka, diretso, di ba?
Yung oxytocin na lang.
Yes.
Sir, ibig sabihin pala, pwede ko tusukan yung tenga, pasayahin ko ng pasayahin yung pasyente, sir.
Ano daw, pasahiin?
Pasayahin niya.
Pasayahin ko palagi yung pasyente.
Hindi masaya yung pasyente mo, hindi kanya gusto. Kaya nga ano, una-una pa lang, hindi mo pa nininidal, gusto ka na. Huwag yung parang engot yung dating, no? Tapos pinapakita mo lang yung certificate, yung mga ganun. Yung iba kasi parang maniwala, wala silang pakialam. What they want is you're really good. So hopefully we can see each other on, actually scheduled to, so 23 siguro. We'll be teaching you how to market yourself, how to sell yourself. We will
Gusto ko
teach
yan.
you, we will
Sige
teach,
po, sir.
ganito po kasi, hindi po ito theoretical ha. Medyo obvious yung pagsabi ko marketing strategy. That will be, okay, wala tayong lecture sa 21, pero 22, yung kidney and heart patterns and also diagnostics. So, doon tayo nakafocus. Pero yung maganda, yung sa 23, kasi alam nyo bakit? Una-una, when you see a patient, no, you should always make sure that the patient likes you from the very beginning.
Yes.
Malalaman na gusto ka ng pasyente. Nag-refer. Nakakataba ng puso. Ang niya, sa tingin mo, kung gusto ka ng pasyente, sino una-una niyang i-refer? Yung pamilya niya, yung mga friends niya.
Family niya.
Family niya.
Family.
Family niya.
Hanggang pagdating ako, nagtitipid akong damit.
Hindi nga. Kaya pa kasi
That every one of us,
Saan doon?
wait lang po.
Pasyente ni Mark, niyaya.
Opo muna, Mark.
Kasama ka.
Hindi ako sumama sa...
Una-una, you have to be likable. Huh? And I will teach you how to actually see an immediate effect sa pulse. This is something you cannot find in the books. I was very grateful. Merong isang ginawa kong guinea pig. Yung naging best friend ko na dito sa Dumaguete, yung si Dr. Ryan. Grabe kasi ang ganda gawin sa isang tao na alam yung ginagawa mo.
Yes.
Grabe, amazing yung effect. Ha? So don't miss it on the 23rd. And if you are able to make that patient happy, hindi yung sa ano lang eh. Hindi lang yung itong endorphin eh. Feel good. Ito pag tinusok mo na. Dapat lumalabas na yung endorphin niya dahan-dahan. Saka, ay, mayroon nga isa, ay, i-refer ko pala yung ano, especially pag nakita mo yung impact niya sa pulse, ay, nagbago.
Yes.
Ito yung parents ko. Daling ko pala dito.
Yes.
Kasi mag-iiyakan ng mga aso ko kung may allergy sa
Ilang
Okay. Okay. Saan ba tayo? So yun. I will teach you how to do it. It requires, alam mo, kahit hindi mo alam ang diagnosis, makita mo lang talaga, no? But you have to know, no? Pag mali yung walang impact dun sa pulse, then probably, I'll teach you how to do that. Yung parang talaga, yung sa actual. Iba kasi yung sa theoretical kesa sa actual, no? So pag hindi siya nagdala or nag-recommend, yun lang. Hindi ka masyadong
Iba talaga, Doc, yung experience.
Yes. So I'll share it with you. So I hope we can, we can see the
Yes.
yes.
Opo.
It's I'm more focused on diagnosis because I believe this is something that makes you different from other practitioners. The kind of questions you will ask will depend on your diagnosis. Okay? And yun. Basta magkita na lang tayo. Medyo mahaba na. Okay, so yun po. Maraming salamat. Ay, hindi pa pala tapos. Okay. So next we go to posterior pituitary naman, Sir Walter.
So posterior pituitary is located at the base of the brain that can stores and release hormones like oxytocin and vasopressin. It's an antidiuretic po.
Okay, yun yung dalawang hormones lang na inaano niya. Oxytocin and vasopressin. At saka maganda yung impact niyan. Nako, So, downward projection po ito ng brain made of neural tissue. It stores hormones. So, ano po ang sinisikret ng anterior pituitary? I'm sure kompletong-kompleto ka rito sa sagot.
ACTH, TSH, GH, prolactin, follicle stimulating hormone, lutein hormone, and yung isa pa. Yung isa nakalimutan ko, sir, yung
Sige, okay lang. Andyan na. Ay, mali ito. Luteinizing.
Lutein po.
Lutein, no? Okay, ano ang you answered this earlier. What hormones do the posterior pituitary secrete?
Oxytocin and vasopressin.
Okay, or ADH, no?
O ADH.
Oo. Okay, mamaya i-discuss natin. ADH is another name for vasopressin. Okay? Ngayon kung stress ka, kahit umiinom ka ng maintenance, wala rin mangyayari, no? The hypothalamus, how does the hypothalamus stimulate the anterior pituitary?
By releasing hormones, somatostatin, and dopamine.
Yes. Anong ginagawa ng releasing hormones?
It can stimulate and inhibit the anterior pituitary gland po.
Okay. It will stimulate the synthesis and release of hormones. Ano naman ginagawa ng inhibiting hormones from the term itself?
Inhibiting, pinipigilan po ng gland po yung
pag-release or yung paggawa. Opposite, di ba? Next, what is another name for the growth hormone?
Ano po? Growth hormone?
No,
number na po?
96.
Okay, Ma'am Susan, will you be ready for 101 to 120?
Somatropin po.
Hindi, ganito. Somatotropin.
Somato.
Somato, yan po yung root word, tropin. Okay, gusto mo bang kasi alam ko nag-prepare ka, gusto mo hanggang 120 ka, Sir Walt? Oo. Kasi parang, mawawala yung flow, no? Malay mo hanggang 40. Okay. Okay. STH.
Walang tawad,
Ano
sir. Kahit
to?
105 lang, sir.
O sige, 110. 110.
O,
Tapos tatawagin ko hindi sumagot si Ma'am Susan, si Sir Freud
Okay po.
na.
100. Ay, sige po.
Okay. Sige, Ma'am Susan, would you like to take care of 110 to 130?
Doc, hanggang 122 lang yung nagawa ko eh.
Okay. O sige, 120 to 150.
Wala internet ko.
Sige, si ano, 120 to 150 si Sir Froilan kasi mukhang ready. Ramdam ko talaga. Okay.
Ganon.
Ano po itong growth hormone, Sir Walter?
growth hormone for development and growth of the body, especially for the bones po.
Tissue building, anabolic, no? Yung iba gumagamit ng pampalaki ng katawan, hindi po maganda 'yon. Hindi ano 'yun hindi siya natural. Okay. Anong ginagawa ng growth hormone?
It governs the height, bone length, and muscle growth po. Stimulates protein synthesis and increase fat breakdown to provide the energy necessary for tissue growth.
Okay, it actually stimulates mitosis, nagdi-divide, no? And it promotes growth of long bones. Pero merong limit yan. Ano nagsistimulate sa secretion of the growth hormone? What do you call this hormone?
Hypothalamic hormone po.
Specifically called
growth hormone.
Di ba si hypothalamus nagre-release ng releasing hormone?
Yes po.
Okay. Ito yung growth hormone, releasing hormone.
Releasing hormone.
Okay, parang mag-release si anterior pituitary ng growth hormone. Get it? So kailangan may releasing hormone. Sabi niya, mag-release ka na. So it's also ito yung nag-stimulate sa growth hormone. Ano naman ang nag-i-inhibit sa secretion ng growth hormone? Kasi hindi naman pwedeng palaki ka ng palaki. Magiging higante ka na. Diba? Anong tawag po sa hormone na to? Sir Walter?
So it was inhibited by hypothalamus by inhibiting the pituitary gland through
Yes. Somatostatin. Parang stop na. Huwag ka nang lumaki pa. No? So pag hindi mo na kailangan lumaki pa, kasi magiging higante ka pag sumobra. So automatic yan, no? So depende kung hindi ka pa masyadong kaya lang iba nagkulang Something went wrong. Kulang sa protein. No? Okay. Anong nangyayari pag decreased yung levels of growth hormone mo, Sir Walter?
Pag decrease po yung growth hormone, hindi lalaki.
Okay, anong
Hindi
tawag?
Dwarfism po.
Okay. Meron din tayong isa. Okay, dwarfism, para ka talagang dwarf. Okay. Ngayon, meron din tayong yung tinatawag na cretinism, dahil po yon sa kulang sa thyroid hormone. Okay? Okay, wag na lang, baka lalo kayo malito. Basta importante, naging decreased levels. Ano naman ang gigantism, Sir Walter?
There is a high level of production of growth hormone in the body which causes the child to grow very tall po.
Okay. During
tumatangkad
years. Okay, so habang tumatangkad ka pa, mabilis yung grabe yung ibig sabihin kulang yung somatostatin, parang sumobra, no? During the growth years. Ano naman itong acromegaly?
So these are disorder that result in excess growth of certain parts of the body Like enlarged hands, enlarged jaw, nose, and forehead po.
So anong pagkakaiba ng gigantism sa acromegaly?
Sa acromegaly, mga certain parts lang ng body po yung lumaki. Unlike gigantism po is tumangkad buong katawan. Tumangkad po kasi yung individual.
Hindi, patuloy pa rin nag-i-increase
Tumatangkad.
yung growth hormone levels after the growth years. Remember, meron tayong di ba? Growing at the
That
age of...
mag-stop.
Oo. So 30 ka na nag-grow pa rin. So hindi ka natatangkad. Lumalaki na lang yung mo, yung mga kamay mo, yung ulo mo, 'di ba? Yan yung acromegaly. Okay, ano naman itong prolactin? Tingnan may mga root word, lactin, pro.
For lactation po. And
Yes.
for the breast development ng mga breast tissue.
Meron ba prolactin ang lalaki?
Hindi po ako sure, sir, kung meron.
Dapat sure ka na.
Wala po, hindi po kasi wala pong
Meron.
Okay. Pag
Di
mataas
ba
ang
meron, Doc?
prolactin ng lalaki,
we have to magkatsaga muna tayo para lang tayo nagtatanim.
okay. Yon. So pag mataas ang prolactin ng lalaki, bababa yung testosterone niya. So hindi na siya lalaki. Okay, next. What inhibits the prolactin?
Through dopamine po. More dopamine being released will cause less prolactin release po.
Okay, pero una-una, muna si mag-e-eksena muna si prolactin release inhibiting hormone, PRIH, no? Okay, ito napaka-interesting nito, kaya lubos-lubusin na natin. What is TSH?
TSH is a thyroid stimulating hormone that stimulate the thyroid gland to produce thyroxine and then triiodothyronine.
What is another name for TSH?
Thyrotropin po.
Okay. So, sino nagko-control sa TSH? Remember, bago siya mag-release ng TSH, meron mo nang kakalabit sa kanya na nanggaling sa hypothalamus. Anong tawag dito?
Thyroid po. Thyroid gland.
No, thyrotropin releasing hormone. So, ibig sabihin, bago siya mag-release ng thyroid hormone, e-eksena mo na si
Thyrotropin releasing hormone.
Thyrotropin releasing hormone. What is another name for TSH?
Corticotropin po.
Hindi Bakit napunta tayo sa corticotropin?
Ano po?
Thyroid stimulating hormone. So dapat na-maintain mo rin yung thyro. Thyro.
Hindi ko po alam, sir.
Thyrotropin.
Thyrotropin.
Yes. Thyrotropin. That's another name for TSH. So, ano ba pagkakaintindi mo sa TSH or thyrotropin? Ito magsasabi kay thyroid na mag-release ng ano bang nire-release ni thyroid hormone, ni thyroid gland? Thyroid hormone. Di
Yes,
ba? Okay.
Tama.
I'm sure nakakita kayo ng so pag mababa ang thyroid hormone levels, anong magiging impact noon sa thyroid gland? Anong gagawin ni hypothalamus ngayon? Kasi si hypothalamus, makikita niyo yung blood levels ng thyroid hormone. Uy, mababa. Mababa yung thyroid hormone. T3, T4, mababa.
I-activate niya, magre-release ng hormone na rin siya.
Okay. Ngayon, mababa pa rin. So, lumalaki si thyroid.
Magiging
Stimulating yung
hyperthyroidism
CBD.
na.
Yes.
Naging hypothyroid,
Yeah.
Hypothyroidism.
Hyperthyroidism
Hypothyroidism,
talaga.
Ayun
no?
tatawag na hypothyroidism, lumalaki. Eh yung hyperthyroidism,
Yan yung lumuluha yung mata, Doc.
yeah, anong
Hindi.
pagkakaiba?
Sa hyperthyroidism, yung metabolic process ng body ng tao,
Malaki.
hyper po.
Malakas.
Okay.
Oh.
So, mabilis siya magutom dahil masyadong
Payat.
active yung metabolism ng person ng may hyperthyroidism.
Sige. Matututunan natin yan in more detail. Okay, sa iyo pa to. What is another name for ACTH? Take note adrenocorticotropic hormone. So, cortex, no? So,
Corticotrophin po.
very good. Mas maganda to, mas maikli, no?
Opo.
Anong kinokontrol ni ACTH?
It responds and control the stress responded by the adrenal gland to make a cortisol po.
Okay. Yeah. So, some secretions ng adrenal cortex. Although hindi natin inaano dito, dinitake up, but one of the most common secretion is glucocorticoids.
Glucocorticoids.
From the term gluco, tumataas ang sugar. So kung yung buhay mo, parati kang stress, parating nagmamadali, parating naghahabol ng oras, parating yung feeling mo, parating nasusunog yung bahay mo, di ba? Malakas yung ano mo. Kung ganun yung buhay mo everyday, grabe yung impact doon. Tumataas ang secretion ng glucocorticoids. From the term glucocorticoids, ano ang tumataas? Gluco. Tumataas ang blood sugar mo. Kaya you don't immediately give medications to lower the blood sugar. You have to distress the patient. Kailangan tingnan mo ano yung dapat baguhin. Hindi dahil kasi yung iba tumataas, kaya yung iba nagtatanong, bakit hindi na ako kumakain ng ganito, ganito? Mataas pa rin yung sugar niya. Meron na siyang maintenance, mataas pa rin sugar. Pero yung pala, kaaway niya lahat yung kasama niya sa bahay.
Yes pala.
Yun. Are you excited?
Oo.
Yes, Doc.
Pakalmahin. O kalma lang. Kalmahin mo lang. Alam mo, bababa yung sugar.
Doc, di ba sa tenga, merong ACTH na tusok?
Oo, alam ko memorize mo na yung tenga. Oo, ibang usapan na yon. Pero alam ko, no, di ba na-excite ka na? O grabe, abot na niya yung ACTH. Kaya ako sa inyo, aralin nyo na dahan-dahan yung iba doon. Like, can you imagine, the endocrine system is so fantastic. Take
Sobra.
endocrine and nervous. That's why this is the second to the last topic, no? Oh, tinan mo si Sir Mark, sabi niya hindi daw siya ready, pero bakit biglang mukhang naging ready? Kasi alam niya yung mga endocrine points, ha?
Siya na yung sunod ko, sir, no? After ko, si Mark na yung sunod, sir.
Yes.
Hanggang wanted lang ako, sir, ha?
Pero sabi niya, may nag-message siya kanina. Siya pa nag-message. Okay. Oo, sige. I have word of honor. My honor. Your honor. Okay, ikaw pa ito, Sir Walter. What is ACTH controlled by? Sino nagko-control kay ACTH?
It is being controlled by the hypothalamus, pituitary, and adrenal glands.
Okay. So anong gagawin mo para hindi na ma-stress ang pasyente? Will you tonify or will you sedate?
Sedate.
Sedate ko.
So may impact ito kay hypothalamus.
Ise-sedate si hypothalamus, sir.
Yeah. Para hindi para ang release niya hindi na mamomotive, ma-stimulate kasi every time ka ma-stress, no? Automatic 'yan. Magre-release ka ng corticotropin. So kailangan i-inhibit mo. Okay, ready na si Maraming salamat, Sir Walter. Alam ko marami ka pang
Thank-
tanong, pero i-reserve nyo na lang
Thank you.
yan when we go to our
Thank you
next.
po, sir. Thank you po.
Thank you po. I'm sure na-excite kayo. Let's call on
Mhm.
Ma'am Susan na kanina pang ready. Sabi niya 111 to 120. Pagkatapos si Sir Froilan 120 to 150. Okay. 121 to 150. Ma'am Susan, are you still there?
Yeah, Doc. I'm here.
Hey,
Diba?
what is another name for FSH? Follicle stimulating hormone.
Polytropin, Doc, these hormones produced by the pituitary glands plays a crucial role in the sexual development and reproduction.
Okay.
FHS is essential for the growth and maturation of the egg of women and sperm in men.
Okay. Anong ini-stimulate? Kasasagot nyo lang eh. What does the FSH stimulate? Yung answer nyo kanina.
It stimulates the follicles in the ovary and growth and prepare the eggs for ovulation.
Okay, so kung hindi ka nangingitlog, blame it on the
FHS.
anterior pituitary.
Okay.
No? When is FSH not present?
During very low during pregnancy. Also, the condition affects the chest production of
Do you find that in children, in toddlers? Hindi pa naman nagme-mens, di ba? So,
Yes.
yung mga pre-puberty, pre-pubertal, hindi pa puberty, hindi pa nila naabot yung So, wala siya
Wala pa.
during the prepubescent age. What is FSH controlled by? Sino nagko-control kay FSH?
Hypothalamic pituitary gonadal, HPG.
Anong tawag doon?
Hypothalamus pituitary gland gonada.
Yeah, gonadotropin releasing hormone. Okay, punta na tayo kay LH naman. Ano naman itong LH, luteinizing hormone?
Luteinizing hormone.
What is luteinizing hormone also known as?
Lutropin.
Gonadotropins, no? What does LH promote?
Superior pituitary gland.
Anong pinopromote niya ng secretion?
Both luteinizing hormone plays a crucial role in both male and female reproductive system, promoting sexual by procedures.
Okay, secretion of sex hormone. Anong ini-stimulate ni LH?
During puberty, LH stimulate both ovaries and testes to make more testosterone in the ovary, testosterone convert into estrogen. Those hormones can change related to sexual development.
What is the difference between FSH and LH in terms of function?
FHS, wait lang daw.
Okay, ganito na lang. Okay, ganito ha. Next time, pag tayo, intindihin natin mabuti. Okay, luteinizing hormone para sa para mangitlog ka, no? Sa lalaki naman, mag-stimulate secretion of testosterone. Samantala, yung follicle stimulating hormone, yung
Tagagawa.
tagagawa
Nagpo-produce.
pa. Hindi pa nangingitlog.
Hindi pa.
Gets nyo? Okay. So,
paano, Dok, yung yung may mga sinasabing nababaog? Paano nun? Ano yung kulang?
hindi. Okay.
Yun, yung FSH nila,
Diba?
ay hindi pala stimulating pala yun. Yung
Yes.
isa pa.
It could be
Releasing
due to
dapat.
stress.
May problema sila sa pituitary kasi doon nanggagaling yung yung production eh.
Do you think pwede kang mangitlog kung masyado kang malamig?
Hindi.
Hindi.
Karamihan, alam nyo ba? Ay nako, ito na lang ha, bago ko makalimutan. Kasi ginawa ko ito sa yung medyo malamig. Kaya hindi siya nabubuntis, malamig parate. Puro pagkain, puro yin. So ginawa ko, alam nyo, nilagay ko lang sa tenga niya yung very basic do for bladder 23, and do 14. And also kidney 7. Since hindi ko alam anong mangyayari, I needled both ears. Although, di ba, ang do nasa gitna lang. Do 4, do 14, kidney 7, and bladder 23. Alam nyo, for the first time, uminit yung kanyang paa. Sabi niya, uminit ako. alam niyo,
Nice.
ginamit ko yung intradermal needle.
Ah,
Pinauwi ko sa kanya yung intradermal. Yung intradermal kasi, nagfo-fall off lang yan siya pag hindi na kailangan. Yun nga lang, nung nalaman niya na kung saan kami napupunta na na cheesecake, bumili ng cheesecake. Sige lang, okay lang, ganun talaga, tao lang. Pero ang importante, doon ko na-realize na mas, di ba sabi natin, mas mabilis pag sa ear. So I needle the ear. I use the sub-Q. Intradermal. So, yun. The mere fact na for the first time, kahit naka-on yung aircon na, uminit yung katawan niya. So, kailangan siya uminit. Kasi hiligid din niya uminom ng malamig na tubig. Soft drinks, yung ganun. You try it. Okay.
Dok, kasi Dok ako, nung bago kasi, 1 year bago ako nagkaanak kasi ang tagal akong ginamot bago nagkaanak. Dahil ang problem is may hormonal imbalance ako. So, may tendency hindi ako magkakaanak. With my case,
pareho tayo.
sunod-sunod naman.
Sunod-sunod na correct. Okay, very good.
Oh.
Congrats. Okay, ma'am, sa inyo pa to. What is LH controlled by?
Hypothalamic pituitary gonadal axis. Tama ba, Doc? Sagot ko.
Yeah, pero you have to be specific. The releasing hormone. Di ba si releasing hormone is produced by the hypothalamus. So yung hypothalamic pituitary axis, syempre, si hypothalamus sa taas. Siya yung taga-kalabit kay pituitary. Di ba? Depende kung releasing ba or inhibiting. Gets nyo? Next, true or yes or no? Does the posterior pituitary release hormones?
No.
Release hormone po, oxytocin and anti-reproductive hormone. ADH.
Yeah, but it only stores the hormone. Okay? Hindi siya nagre-release. Kailangan mo pa yung nerve, kaya pag stress ka, walang mangyayari. Di ba sabi ni kanina, stores. Nag-i-store lang siya. So ang may kinalaman dyan, si hypothalamus pa rin.
Tapos tutulak niya sa anterior, tapos si anterior tutulak niya sa posterior para lumabas.
Yes. Ini-store lang niya, pinupondo. So pag nagpo-produce ka nga, kasi you know the difference between producing and releasing. Okay? Oxytocin. Will we discuss it? Okay, mamaya na yung oxytocin. Vasopressin is important, no? Kaya yung iba mataas yung blood pressure. Hindi na release. Okay. What does the posterior pituitary contain?
Wait lang. It contains and release 2 hormones that are synthesized into hypothalamus, oxytocin and an antidiuretic hormone, ADH.
Na-mention nyo under the command of the hypothalamus. Okay? So hindi siya mag-release pag wala si hypothalamus. So ayusin mo pa rin si So ang nangyayari, mayroon siyang nerve fibers and neuroglial cells called pituicytes. Okay, maraming salamat po, Ma'am.
Thank you po.
Ma'am Susan. Punta na tayo sa kanina pa ready. 20 to 50. 21 to 150. Okay, Sir Froilan. What is stored in the posterior pituitary?
The oxytocin and the antidiuretic hormone.
Okay.
Nandito ba? Number 22. Number 21.
Secretory cells of the hypothalamus are called
Ano pong number?
number 122 na tayo. Tama yung sagot mo kanina.
Neurosecretory cell.
Yes, wow, ang galing. What is the ADH? Antidiuretic hormone. Sa Tagalog, paano mo to i-explain? Ano ba ibig sabihin ng antidiuretic? Di ba diuretic nang umiihi ka?
Para hindi maihi. Pampigil sa
Ano
ihis.
ang purpose nito? Bakit hindi ka pa iihiin? So, ibig sabihin mga anti to no? Di ba? So, may reason. Ano po bakit po kailangan hindi ka maihi parate?
Para hindi
Para hindi ka-
ma-dehydrate, sir.
Yes, para hindi ma-dehydrate. Ang galing talaga. At saka, mag-water overload, kailangan mong paihi. Okay. Sinong tina-target ni ADH? Last Monday, we talked about the urinary system, right? So, what part of the nephron?
The kidneys.
Nephron.
Sinong tina-target ni ADH? Anyone? The distal convoluted tubules, the DCT. Masanay na tayo sa mga abbreviation. Okay, anong piniprevent ni ADH, Sir Froilan?
Excessive water loss through urine.
Yes, very good. Or urine formation. What does ADH cause to happen?
Causes the kidneys to absorb more water.
So anong mangyayari kung mataas ang ADH levels mo sa dugo?
Mataas.
Ihi ng
Hindi. Hindi ka nga maihi.
Tataas ang blood pressure.
Yes, ang galing. Wow. Very good. Next, what does oxytocin or OT stimulate?
Uterine contraction.
Yeah. And
Milk injection. Yes.
milk ejection reflex. Kaya this is the reason why some women, lalo na pag yung mga masyado ng topak, masyadong stress or hindi maganda yung, 'di ba? Parang hindi welcome yung papapanganak niya, no? Yung meron pang postpartum depression. Affected talaga. Hindi sila
Hindi umiihi.
lumalabas yung milk. So you need to know the difference. Kaya ang nangyayari, namamaga. Next, what produces oxytocin?
Hypothalamus.
Yes. Okay. In response to uterine and vaginal wall stretching and stimulation of breasts. Kaya dapat yung suckling reflex ng bata, no? So, ang hypothalamus ang uma-action yan. Diba? What is the thyroid gland? Tell us about the thyroid gland.
Thyroid gland is a vital endocrine gland that plays a crucial role in regulating the metabolism, growth, and development, and mental activity.
Yeah, this is also the largest endocrine gland. Ano ito sila? Alam akong wrong spelling. Thyroxine yan ha. T-H-Y-R-O-X-I-N-E. I will correct it later. T4 and T3 are what?
Thyroid hormones produced by the thyroid gland.
Anong component ng T3, T4 ang deficient pag mababa ang levels? Ano yung mineral component nitong T3, T4?
Sodium.
Iodine.
Iodine.
Iodine. Okay, iodine. Diyan na triiodothyronine. Next, what do T4 and T3 do?
For regulates metabolism, growth and
Yes.
development, and
Metabolism
influence other
of
body.
lahat, carbohydrates, lipids, and proteins. No? Kaya sa Chinese medicine, we consider it to be phlegm. Bakit? Hindi natutunan. Walang metabolism nangyayari. No? Increases metabolic rate. So, kulang ka sa yang kung meron kang growth dyan. Regulates tissue growth. Mas mataas yung T4, T3 is more potent. Ito yung free thyroxine, no? Okay, I have a question. If you are the practitioner, ano yung let's say yung pasyente mo is on a budget, no? So we all know that the TSH will be stimulated if mababa yung thyroid hormone mo, di ba? Do you follow? So ibig sabihin, pag mababa yung thyroid mo, kasi kulang ka sa iodine or probably marami kang, marami kang emotional issues. So ang nangyayari, tataas ngayon si TSH, di ba? Ngayon, pag mataas na pag mataas yung thyroid hormone mo, ano mangyayari kay TSH? Bababa or tataas?
Bababa.
Bababa.
Tataas? Bababa.
Okay.
Bababa.
Yung ibang practitioners, para makagastos ng malaki, nagre-request TSH, T3, T4. Ikaw, ano sa palagay mo sa tatlo ang pinaka-practical na dapat mong i-request lang na malalaman mo na ano ang actual sitwasyon ng pasyente?
Emotional.
TSH, di ba? Kung normal ang TSH, ang ibig sabihin, ano yung maingay?
Ingay, Mark.
Okay, okay. Sige. Okay, kung gets nyo, kasi kung normal ang TSH, ibig sabihin, hindi mataas si T3, T4, hindi din siya bababa. Gets nyo? So pinaka-practical, kunin mo yung TSH para tipid. Mahal kaya ang thyroid panel, ha? Diba? Okay. Ang importante, lumiliit. Importante, lumiliit. So kailangan mo ayusin yung
TSH para bumalanse.
yes, bumalanse. Okay. Okay, Sir Froilan. What controls T4 and T3? Ay, naku, kasasabi ko lang.
HS.
Yes, TSH. Very good. What does... Okay, punta naman tayo sa calcitonin. Anong nilo-lower ni calcitonin?
Calcium levels in the blood.
Yes.
Wala.
Okay, bakit niya ilo-lower? Paano? Para hindi ka mawala ng okay, ganito kasi yan. Pag mababa kasi calcium mo, as much as possible, hindi ka magre-release ng calcium from the bones. Do you follow?
Yes.
So, ini-inhibit niya yung pag-release mo ng calcium. Okay? So, nilo-lower niya muna yung blood calcium mo and phosphate ion para magtipid. Kasi pag tumaas yung ano mo, kaya hindi tama yung iinom ka kaagad ng ano, ang ayusin mo, di ba? Calcium supplements will not help alone. You have to also do something with your endocrine system. Diba? Kaya napansin niyo yung iba, inom ng gatas, ganun pa rin, masakit pa rin. Actually, lalong lumala. So, kailangan, punta sila sa clinic ninyong lahat. Tapos puro ear lang. Ay, bakit nawala? So, can you imagine, no? Yung pain, Inayos mo din yung ano niya. Kaya mamaya i-research ni Sir Mark lahat yan. Imagine, alam niya saan yung ACTH point.
Wow.
I'm sure meron siyang yung ang dami-daming points. Actually, nasa libro natin yan, no? Wala yung iba niya. Ako pa sa inyo mag-level up. Ang dami po kasi ano, alam niyo ba pag may problema ka sa ano, affected yung endocrine mo. So I'm sure
Mhm.
ang hirap kaya i-treat ng hormonal imbalance, no?
Mm. Pero
Yes.
marami po. Maraming nangangailangan ng treatment
Yes,
sa hormonal
marami.
imbalance.
Kaya ano, we look forward to you sharing your expertise, no?
Kung malapit na.
What does calcitonin increase, Sir Froilan?
Calcitonin doesn't directly increase calcium levels.
Yeah. Kasi gusto mo mag-form ng mag-produce ng osteoblasts, no?
Mm.
So ini-increase niya yung pagdeposito mo ng calcium and phosphate sa buto. Bakit? Kailangan mo mag-form ng bones, no? So what I'm trying to say is, if you want to increase your calcium intake, it's not just a matter of, drinking milk or taking calcium supplements. You still have to take a look at your nervous and your endocrine. And take note, sumikat ang auricular therapy because of that. Okay? So, bulat-latin nyo na yung chart na naiinis tayo dati. Ang daming points doon. It has both European and the Chinese. So, kailangan alam muna natin yung Chinese, yung very basic. Pero grabe yun sa European.
Diyan.
Nasa nutritional medicine ako, pwede ako dito.
Very good. Nutritional medicine. That's interesting. Yes.
Mhm.
Yeah. So you have to make sure lahat ng kinakain niya nanda-digest, no? By making
Metabolize at
sure.
saka na-assimilate.
Yes. Interesting. What is the order of operations for the thyroid? Or paano yung hierarchy, Sir Froilan? Starting from the
Okay po. The order of operations for the thyroid can be summarized as: first, hypothalamus releases TRH.
Yes.
Second,
Tapos?
pituitary gland releases TSH.
Okay. Yes. And then
third, thyroid gland releases T4 and T3 in response to TSH.
Yeah, yan na yung tinatawag na hypothalamic pituitary axis. No? So pasensya na napahaba tayo ngayon kasi kailangan talaga natin ito malaman. And this is the most exciting part. What is the parathyroid gland, Sir Froilan?
The parathyroid glands are important in tightly controlling calcium levels in the bloodstream.
Okay. Anong ini-increase ni parathyroid hormone?
The blood calcium levels.
Okay. So ganito yan bakit pareho yung, di ba nakita nyo, parathyroid. Si thyroid hormone, si thyroid gland, yun yung parang, doon yung si calcitonin, di ba? Si calcitonin naman, na hindi ka magre-release kasi gusto mo ng bone formation, osteoblasts. Ito naman, osteoclasts. No?
Baliktad.
Oo. So, we increase the blood calcium levels by stimulating osteoclast production. So, ibig sabihin, ito yung dapat tutukan natin, yung parathyroid. So, hindi ka magpo-form ng bone, pero kailangan mo, kasi dapat pumunta yung i-destroy mo yung, osteoclast, no? Ito yung magdi-destroy ng bone para pumunta sa bloodstream. Yung calcium. Do you follow?
Para tip off yung calcium from the surface ng bone tapos pupunta sa bloodstream.
Yes. Yeah, but ang mag-o-offset noon, kasi hindi naman po pwede puro din calcium. So ang mag-ano doon, nakikita nyo, nagbabalance sila, check and balance.
Check and balance.
Okay.
Anong
dinidikit parathyroid hormone, Sir Froilan?
The parathyroid hormone decreases the phosphate reabsorption in the
Yes.
kidneys.
Very good. Anong ini-stimulate ni parathyroid hormone?
Stimulates the release of calcium from the bone.
Yes. I-excrease
Absorption.
yung phosphate, i-increase niya yung phosphate, ilalabas niya yung phosphate, i-retain niya yung calcium. And ang pinakamaganda dito, tingnan niyo po to, promotes calcium absorption by intestines. No? Kaya kung umiinom ka ng gatas, kailangan mo pa rin ayusin si PTH. And calcium is used in muscle contractions. Punta naman tayo sa adrenal glands. What are they?
The adrenal glands, also known as suprarenal glands, are small, triangular-shaped glands that sit atop each kidney.
Okay.
They
Ano
are
ang
part of the endocrine system.
Okay, the adrenal glands are divided into what? Two sections, di ba? Nakita nyo? Adrenal cortex, adrenal medulla. Inner region yung medulla. Ang outer is the cortex. Kaya, saan kaya ang glucocorticoids lumalabas? Sa cortex. Di ba?
Cortex.
Tingnan nyo, nakapatid
Adrenal cortex.
kidney. So may reason. 'Di ba? Kung naubos na yung yin mo, parati kang stressed. Okay, parang depende kung paano mo pinressure si kidney mo, no? Because some of us have forgotten the fact na tao lang tayo. So what are the three layers of the adrenal cortex?
The zona glomerulosa, zona fasciculata, and zona reticularis.
Very good. Anong ginagawa ng adrenal cortex?
The adrenal cortex is responsible for producing hormones that regulate blood pressure, metabolism, inflammation, stress response, and sexual development.
Okay. Alam naman natin na some are using steroids, no? You're familiar with synthetic steroids.
Yes.
Okay. Some doctors, they prescribe it for a short period of time to relieve the pain, relieve inflammation. So ngayon, kung dependent ka doon, do you think magre-release ng corticosteroids ang sarili mong adrenal cortex?
Hindi
Oh.
na.
Hindi na. Maging inutil na. No? Okay, you have to be careful, ha? For those people who are on steroids, yung katulad ng prednisone, no? You cannot taper you cannot discontinue kaagad. Baka mamatay yung pasyente mo. You taper it.
Gym coach
Usually
me.
3 to 6 months, no? And then kailangan mong i-acupuncture siya para eventually ini-stimulate mo na yung adrenal. Tingnan mo, perfect talaga yung creator natin, no? So we have the adrenals to actually help us deal with inflammation, with yung mga pinagkakain natin na nagkukos ng inflammation, no? Yung mga tinatawag na pro-oxidant, ano ba tawag dito? Yung
Inflammatory food.
inflammatory food. So, andun lang pala, no? It's still the do you get what I'm trying to say? Okay, Sir Froilan, what is aldosterone?
Aldosterone is a vital hormone that plays a critical role in regulating blood pressure and electrolytes balance.
Okay. So, nasa PCT to, it increases blood volume and pressure. So, kailangan check and balance pa rin, no? Okay, wag niyo na masyadong itong baka masiraan kayo. Ito naman, tina-target niya si PCT. O yung isa naman si DCT, di ba? Okay. What is cortisol or hydrocortisone?
Cortisol is a vital hormone that regulates several bodily functions, including metabolism, blood pressure, inflammation, stress response, and the sleep-awake cycle.
Okay, ito na yung sinasabi ko kanina. It is a glucocorticoid. It is your cortisol, hydrocortisone,
Cortisol.
na nasa zona fasciculata. It regulates glucose metabolism, so stimulates synthesis of glucose from non-carbohydrates. It is controlled by corticotropin releasing hormone and ACTH from anterior pituitary. Huwag masyado kayong mag-isip kasi uulitin natin ito pag nagtitreat na kayo ng pain. Napansin nyo, yung mga tumataas ang sugar, may mga pain din.
Oo.
Is that trying to show, is that telling you something?
Antindi.
Ngayon,
Laging
kung
mga
inom ka ng pain relievers, masisira naman yung kidney mo. So ano na? So si PCT, si DCT, mag-a-apekto na. Tapos nag-lose ka na ng calcium. Bibigyan ka ng calcium. Okay, Sir Froilan, what are adrenal
Yes.
androgens?
Adrenal androgens are a group of steroid hormones produced by zona reticularis
Okay.
at the adrenal cortex.
Okay, ito yung backup ng ating mga gonads, no? Yung mga sex hormones na galing sa gonads natin. And so you see, it still boils down to how we take care of the adrenals. And I'm sure memorized na ni Sir Mark, sa itsura pa lang niya ngayon, kung saan yung ACTH, kung saan yung iba pang mga parts doon. Kaya laliman na natin yung ating pag-aral dyan. Okay,
Yes.
what hormones are released by the adrenal medulla?
Catecholamines.
Yeah, the epinephrine,
Catecholamines.
epinephrine. Okay, di ba pag may sunog, ito yung mag-activate sa inyo.
Yung ba
Diba?
yung ano?
O
Yung,
syempre,
yung
yeah.
adrenaline rush.
But
Yan po
remember,
ba yun?
it's your kidney that is affected. Dahil sa lifestyle mo, marami kang jowa, marami kang responsibility. You have to make money, yung mga all these things. So eventually, this will affect your adrenals, right? And when the adrenal is affected, you have both the medulla and the cortex. No? So do you think mapoproduce siya ng natural steroids mo? Kaya meron kang pains. Do you think kaya ang iba parating gulat, parating pagod? Yung feeling mo di ba pagkatapos mo makita na nasusunog, no? Kasi nakakabuhat ka pag di ba? O kahit mabibigat. You feel so exhausted, di ba?
Yeah.
Okay.
Adrenaline.
What controls the release of epinephrine and norepinephrine, Sir Froilan?
The sympathetic nervous system.
Okay. So, di ba meron din tayong sympathetic point? Memorize ni Sir.
Yes. Nung yun.
Kaya wag niyong kahit walang pain ha, yung di ba tatlo yon yung sa Chinese na chart. Sige, kayo na alam niyo na yan. Fight or flight. Kailangan gawin talaga natin to. We should have two types of treatment for auricular, no? We have the preventive and also the therapeutic, no? So yung tawag na so you can come up with a menu. Okay, what happens when epinephrine and norepinephrine are released?
Triggers a cascade of physiological changes in the body.
O tingnan nyo, ito nangyayari. Tumataas yung blood pressure mo, nagpapalpitate, increase yung naka-tachycardia ka, no? Vasoconstriction, respiratory airways will dilate, increases depth of breathing, blood glucose level increases, metabolic rate increases. So you have to partner with an endocrinologist. Huwag mo naman kontrahin yung mga niya. Di ba? Okay. Because ang gusto lang ba natin mangyari is makatulong para hindi na masyadong magastos, di ba? Malay nyo yung iba dyan na kanina pa hindi umihinga, ang dami ng points iniisip. Si Sir Mark, mag-endocrinology na yan, specialty niya. Okay, next. What is the pancreas, Sir Froilan? This is your last question. Ang haba, no?
Pancreas is a vital organ located in the abdomen, playing a crucial role in both digestion and blood sugar regulation.
Okay. Alam nyo ba ang pancreas pati spleen, iisa sa Chinese? So,
Mm.
yeah. Hindi pa nila na-discover yung pancreas. Wala yan sa sa TCM. Pero parang sinabay na natin yung pancreas sa spleen. Kaya dampness pa din, yung mga diabetes. Thank you so much, Sir Froilan. Alam ko na stress ka konti. So remember, pag
Thank you,
masyado
Doc.
yung sympathetic mo, tumataas yung sugar. Baka kaya nang sagutin ni Sir Mark ang yung last 20. Or
Yes.
kaya na? Or
Go, Sir Mark.
Tyrone.
Hindi ko mo kaya to. Next time na lang po ako.
Okay. Sir Tyrone, para hindi naman sayang. Sir Tyrone?
Yeah.
Ready. Okay. How does the pancreas function as an endocrine gland?
The pancreas function as an endocrine gland is in regulating blood sugar levels.
Okay, actually, it produces insulin and glucagon. Depende sa kung anong status ng blood sugar, no? Okay, ano naman yung function niya? How does it function as an exocrine gland? Ibig sabihin, hindi sa bloodstream. Doon sa...
By producing and secretion digestive enzymes and bicarbonate into the small intestine.
Yes, very good. What are pancreatic islets or the islets of Langerhans?
Also known as the islets of Langerhans, are small clusters of endocrine cells found scattered throughout the pancreas.
So they produce hormones, right? Okay, what are the two types of pancreatic cells? And what do they
Exocrine
secrete?
cells and endocrine cells.
Alpha cells, they secrete glucagon. Ay, naku, sumobra na yung mo.
Alpha
The
and
two
beta.
types of pancreatic cells are alpha cells and beta cells. Yung alpha cells, nagsisecrete siya ng glucagon. Yung beta cells, nagsisecrete ng insulin. Kaya kung gusto mo na in terms of, talagang, you have to make sure na gagana yung pancreas mo, both endocrine and exocrine. You have to always make sure na inaayos mo yung pancreas point mo.
Yes, Doc.
What does glucagon do?
Glucagon is a hormone produced. Its primary function is to raise blood glucose levels when they fall into low, presenting hypoglycemia.
Okay, ganito yan. Ang glucagon, it has to be released pag mababa yung blood sugar mo. Mas mababa yung glucose mo. Now, lahat ng mga cells, yung glucose natin, di ba pumupunta siya sa ini-store siya ng liver. It is stored in the form of glycogen. So ngayon, in times of need, let's say bumaba yung sugar mo, the glucagon will now stimulate the liver para i-break down si glycogen para maging glucose. So reserva parati si liver. At saka ini-stimulate din niya si liver para i-convert yung non-carbohydrates, lalo na pag nagpa-fasting ka. No? Gets nyo? Kasi we also have, we also get glucose from non-carbohydrate sources. Stimulates the breakdown of fats and it increases blood glucose levels. So this is the way na nagsusurvive ka pag nagpa-fasting ka. In fact, it's very healthy, di ba? What is glucagon controlled by? Or ano yung ano ba tawag dito sa Tagalog? Yeah. Ano nagkokontrol sa glucagon? Sir Tyrone.
Glucagon is controlled by a multitude of factors, including blood glucose levels, insulin, the autonomic nervous system, and other hormones like epinephrine, somatostatin, amylin, and glucagon-like peptide.
Oh, you see? Amazing. Galing. Nag-over, ano na tayo? Sana hindi kayo pagod, ha? So, insulin promotes the formation of glycogen from glucose. So, ito na yung trabaho ni insulin. Yung glucose, pinupunta niya sa ano. Kaya bakit yung iba nagkakaroon ng fatty liver? No? Kasi nga, hindi na niya ma-convert into, hindi na niya nadadigest si fat. Ang dami ng, di ba? Kaya di ba yung mga diabetic na iba, nagkaka-fatty liver? It inhibits the conversion of non-carbohydrates into glucose. Kasi nga, ang taas na ng glucose. Enhances movement of glucose into adipose and muscle cells, decreases blood glucose levels, enhances synthesis of proteins and fats. Okay, sino nagko-control again kay insulin?
Hormone insulin.
Blood glucose pa din. Pag mataas si glucose. What is the pineal gland also known as?
The pineal body or the FETCs,
Kompleto.
cerebri.
Okay, nandito po, cerebri. Yeah. Pineal gland. Yung iba sinasabi, yan yung natin, third eye. So, nandyan din si yin tang. Kung titingnan nyo, pag pinrest nyo to or tinusok nyo yan, dire-diretso yan dito.
Dito.
What does the pineal gland do?
What does the pineal?
Anong sinisikrit niya?
Melatonin.
Yes. So bakit yung iba kailangan pa ng melatonin? Dito sukin mo na lang yung intang.
Correct.
Get mo?
Mhm.
See? Interesting, right? It affects moods and emotions. What inhibits the pineal gland?
Liwanag.
Kasi
The
dapat
light.
magting ka na.
Mhm.
Where is the thymus located?
The thymus is located in the chest behind the breastbone, the sternum, in front of the heart.
Pupunta na sa inyo?
Sternum.
Mark.
Smart to. Wait lang. Hindi si Mark, si Walter. Yan.
Si Mark.
Hindi, si Walter. Okay lang. Where is the time? Okay lang. Where is the time? Okay, sinagot na yata. Does
Behind
the
the breast
grow? Lumalaki ba si thymus?
Sir, Doc, pakiulit po?
Does the thymus grow?
Yes, the thymus grow during childhood.
Hindi na siya nag-grow.
Reaching its peak size around puberty.
Okay. Siyempre pag bata ka pa lumalaki siya, pero tumitigil na siya kalalaki. So kaya
Yes,
lumiliit.
Pero
Parang
lumiliit din as we grow older.
Okay,
Hindi.
what does thymus? Hindi, kasi hindi siya liliit kasi lumalaki ka.
Hindi, lumalaki ka, kaya mukha siyang
Kaya
lumiliit.
mukhang maliit. Yeah. Galing. Okay, what does the thymus secrete, Sir Tyrone?
The thymus secretes thymosin, thymosin and thymic
Poetin.
human factor, THF.
Okay. Alam nyo, we have to include this because this is so important for the immune system. No? Okay, what does the thymus promote?
The thymus promotes a strong and effective immune system by nurturing the development of T cells.
Very good. T cells. What are the gonads?
The gonads are also known as the sex glands or reproductive glands. They are responsible for producing gametes, sex cells, and sex hormones.
Okay, kasama na dyan si ovary, testes, even
Testes and
placenta. Anong sinisikret ni ovaries? Two hormones.
The ovaries secrete two primary hormones, the estrogen and the progesterone.
What do the testes secrete?
The testis secretes a primary hormone called testosterone.
Good. What does the placenta secrete?
Hormones.
Hindi, anong tawag?
Ang tawag.
HCG. Importante yan.
Human
Chorionic gonadotropin. Okay. Nagko-stress na kayo, gutom na kayo. Okay, malapit na tayo. I think this is the last one. What are secondary sexual characteristics controlled by?
Sex hormones.
Estrogen and testosterone. Do women have testosterone?
Meron.
Okay. So kung mas mataas yung testosterone mo, relatively higher, then you will have an issue with your sexuality. The same thing with okay? So now you know. Kaya mamaya na lang natin pag-usapan yan. Alam ko gutom na kayo. Thank you so much. I hope you enjoy tonight's discussion.
Thank you po, sir.
And alam ko
Very
medyo matubo ang endocrine.
Very interesting.
Gusto ko
Thank you,
yun.
Doc.
Thank you po, Doc.
Maging 2
Thank you.
hours tayo. Akala
you.
ko matatapos na 6:30. I'll see you again on Monday. Monday. Oo. So doon natin pag-uusapan yung T cells and B cells and ano yung HIV, no? Yung mga ibang ano diyan. Maraming salamat po. Alam ko yung iba
Thank you, sir. Thank you, sir.
tapos na.
Thank you po.
Good night everyone and see you on Monday same time.
Thank you, Doc.
Thank you,
Good
sir.
night.
Good night.